Welcome to Beat Diabetes. I'm Dennis Pollock, and we're going to be talking about Dr. Jason Fung. And if you have watched my channel for long, I'm sure you've heard me speak of him. He has his own diabetes YouTube channel, and it is excellent. I really like Dr. Fung, appreciate what he says. And he has started a series on, I think he calls it the complete reversal of diabetes, and he's got parts 1 through 6. At least that's what he plans. I think he's got 3 of them done, and I wanted to talk about the first one and just kind of talk about him and his approach to beating diabetes. And let me begin by saying there's very little daylight between him and me in terms of what we advocate. He obviously is a lot different from me in probably 1,000 different ways, and for starters, he is a medical doctor and I'm not. So we have our differences, but in terms of what he advocates for beating diabetes and what I preach, proclaim, and advocate, very, very little difference. There was a time where there was a few differences, in my opinion. I remember hearing him at one point say, and this was years ago, that he often would tell his patients to be concerned with intermittent fasting, and he would kind of leave off the low carb part. He felt like it was easier for them to do the intermittent fasting and control their eating to a certain hours of the day. But he thought it was just asking too much, and it would be too intimidating for them to do the low carb. And I thought, well, that seems like you're wimping out. The low carb part is, in my estimation, is far more important than the intermittent fasting. Intermittent fasting, or I don't even like to call it that, you're not fasting. You're simply controlling how much time of the day you eat. And essentially, you're stopping to snack. You're just not snacking anymore. And you're limiting your meals within 8 hours or 6 hours or 10 hours, whatever you decide to do. And I'm all for that. But I didn't like the idea that he would tell people to just focus on that and he would leave off the low carb. He doesn't seem that way anymore. In his books, in his lectures, in his YouTube channel, it looks to me like that he is starting to hammer the low carb theme very strongly. So good for you, Dr. Jason Fung. And one other thing is that in his early days, I never heard him, now maybe he did and I just didn't hear it, but I never heard him or read him saying anything about using a glucose meter or using that to craft a diet. That seems like he's changed his mind on. Now he's emphasizing that as well. So, and one thing that I never did in the early days was talk about intermittent fasting, and he kind of introduced me to that. I call it time-restricted eating. So he's become a little bit more like me, and I become a little more like him to the point where there's just not much difference. Let me just kind of get into this first video that he has produced. It's short. It's maybe 12 minutes long. And he talks about, as he says, the complete guide. This is part 1. There's going to be 6 parts to reversing diabetes. And he starts out by talking about how they never used to even consider the idea of diabetes reversal. In fact, they didn't believe it was possible. And they would say things like diabetes is chronic, it's progressive, it's going to get worse, you'll always have it, you'll never not have it, and it'll be worse next year than it is this year, and 10 years down the road it'll be worse still. And that's not what he has experienced with his many patients, nor has that been my experience with people that have kind of followed along with some of my recommendations. It can easily be reversed if by reversal you mean my A1C's down, my fasting glucose is down, and I don't have the symptoms I used to have and the diabetic complications I used to have. If by that you call it reversal, then yeah, absolutely, it can be proven again that it can be reversed. Now, if you want to say, yeah, but Dennis, don't you agree that you still have kind of a diabetic tendencies and you could easily become diabetic if you went back to eating the way you used to? The answer is yeah, I could easily. If I wanted to make myself diabetic, I could be fully diabetic in 6 months just by eating the junk diet that many of you eat. But I'm not going to do that. So to me, that's not hardly an issue. But doctor, I look at it this way. If you used to have an A1C of 12 and a fasting glucose of 190, and you had neuropathy pains, and you had burning feet, and you had erectile dysfunction, and the doctor's telling you your kidney is failing, and your eyes are going blind, and you got bleeding in the eyes all the time. You had all that, and now it's gone, and your A1C's gone from 12 to 5.2. Well, I'll tell you what, something has been reversed. If you say, well, I just don't want to call it reversal, well, fine. The one term a lot of people use is remission. Your diabetes has gone into remission. But however you call it, you have done yourself a world of good by getting that A1C down and by following the right steps to turn things around with your diabetes. Something has been reversed when you've seen all that much improvement. All right, well, let's get into a couple of the things he said. I'm not going to repeat all that he said. Obviously, I'll put a link in the description where you can watch him for yourself and see his whole video, but I just wanted to make a few points. He says the goal should be to reverse your diabetes, not just to medicate. And again, it's so refreshing to hear a doctor say that some doctors just feel like my job is a pill pusher. My job is a medication prescriber. That's what I do. That's all that I do. That's all I ever intend to do, is just prescribe medication. I'll diagnose your situation. I'll tell you what's wrong, and I'll give you the appropriate medication, and you go on your merry way. And Dr. Fung, one of the things he loves to say is diabetes is a dietary disease. Let that sink in your brain. And let me say it again. Diabetes is a dietary disease. And if it's a diet that got you in trouble in the first place, then by changing your diet, you can change your diabetes. You can lower your glucose. You can eliminate many of your symptoms. And what symptoms cannot be completely eliminated, they can sure be improved upon. So it's a dietary problem. Let me shout it from the housetops. Your problem is diet. That's what's getting you in trouble. And it's not just the high glucose, even your obesity is coming more from your diet than it is from your lack of self-control. And I'm not against self-control. It definitely has its place in life, and it's called one of the fruit of the Spirit in the Bible. One of the fruits of the Spirit is self-control, so I'm not against it. But in many cases, if you can just eat less carbohydrates, you'll lose weight without even trying, without even feeling like you're sacrificing much, except you're changing around some of the foods that you eat, but you're still getting full. And that's the thing that we all want. After you eat supper or lunch, you want to leave the table feeling pretty full. And if you leave the table half starving and famished, and you'll find yourself dipping into the cookie jar or the popcorn bag or whatever it is. So it's a dietary disease. It needs a dietary fix. Now, another of the things that he says in his video about diabetes reversal is that your body's like a sugar bowl, and you're just collecting sugar. When you eat starches and when you eat sugar, it's just adding to the sugar content in your body. And one of the points he makes is that carbohydrates are sugar. Carbohydrates are sugar. It's just in a different form. It doesn't taste sweet. So you can have a big old soft pretzel, and there's not any sweet taste to it at all. It doesn't taste like cake or ice cream or a candy bar or a soda. There's no sweetness to it. It's salty, but it's not sweet. But it is made of sugar. All starches, all carbohydrates are sugar molecules twisted and shaped and fashioned in such a way that they don't necessarily taste sweet. Now, in some cases, you can take that carb and you can add sugar to it, like a donut. So you got the white bread, which is sugar, which is carbs, and then you put sugar on top of it in a glaze form. You got more sugar, about the worst thing you can eat. So he uses the illustration that your body's like a sugar bowl. The more you eat, the more sugars and starches and carbs you eat. You're storing up sugar until your body can't handle it anymore and it spills over into your blood. Well, I think there's one other factor that he doesn't mention that needs to be mentioned there. When you eat a lot of sugar and starches, carbs, it's not like all that sugar is going to just be floating around in your body, in your muscles, in your tissues, and in your liver, and in your pancreas. It's not like you're just so loaded with sugar. Your body's going to take so much of the sugar and the starches, and it's going to turn it into fat. So that what's primarily going on in your body that it's overloaded with is fat. Fatty pancreas, fatty liver, fat in your belly, fat in your organs, fat all over the place. But that fat is really the result of a lot of starches and sugars and just excess food, eating more food than you need to so you don't burn it off. And what he says in his video, and he also says it in his excellent book, The Diabetes Code, is the two things you do. Number one, stop adding to the load. If you're full of sugar and fat, the last thing in the world you need is more sugar and fat. So stop adding to by eating proteins and fats instead of sugar and starches. And number two, practice intermittent fasting, or as I would put it, time-restricted eating. And that's going to help you burn off the fat that's all over the place that started out as sugar and starches. So it can be done, my friend. You can beat diabetes. Don't let anybody tell you you cannot. You do not have to live like you are right now with those diabetes complications, with having to go to the doctor every so often to get shots in your eyes and having to take all kinds of medication and be sure and take your diabetes pills. Be sure and take your insulin. Now, we're talking type 2 diabetes here. Type 1 is a whole different critter and doesn't so much apply to this, although you can be type 1 and still be insulin resistant. If you're type 1 and you just take so much insulin and you eat so much food that you're an overweight type 1, then you got a double problem. But primarily we're talking type 2. And the good news is you can beat that sucker. Diabetes is not invincible. Sometimes we look at diabetes as like, the invincible monster nobody can defeat. My friend, people are defeating diabetes every single day. In the U.S., in Africa, all over the world, people are learning, I can whip that sucker. When I was a kid, there was a little boy, well, I say little, I was little, he was little, so we were both small, named Billy. And Billy used to pick on me. Billy used to pick on me. And I didn't like Billy for that. Who wants to be picked on, right? And one day I decided to kind of fight back. And I found out I could beat Billy. It never dawned on me that I could beat Billy. I thought Billy always had to beat me up, or in his own little small way. And when I found out I could beat Billy, the whole roles reversed. And suddenly I used to pick on him, which wasn't a good thing. Sorry, Billy, if you're listening. But what an amazing, what a exciting thought. I can beat Billy. I'm tougher than he is. Well, as long as you eat the diet you've been eating, you're not tougher than diabetes. It'll get you. It could kill you and ruin your life. Absolutely. But if you'll fix the diet part and do some time-restricted eating, you'll find out you're tougher than Billy. You're tougher than diabetes by the grace of God. And you can see it recede and retract out of your life and move away and get smaller and smaller and smaller. And yeah, there'll be the naysayers and the critics that say, yeah, but if you go back to eating the way you once did. Well, who in the world told you you ought to do that? Again, quoting Dr. Jason Fung, diabetes is a dietary disease and it requires a dietary fix. The question that so many people have about us is how in the world did you guys get to know each other? How did you get together? Well, the answer is found in Benedicta's new autobiography, When Destiny Calls. In fact, we do something in that autobiography that is almost never done. We each have a chapter sharing from our own perspective how we got together and how we first got to know each other. So she tells her side of it, I tell my side of it, and then it goes on with the rest of her autobiography. And the whole autobiography is exciting. There's a lot of drama and a lot of good stuff. But I think you'll find it interesting to know how it was that God brought us together. So there'll be a link in the description about how you can get this book on Amazon, either as an ebook or a paperback.